laws. As states relax marijuana laws, police are using a method drawn from medicine to know who is driving impaired. They call themselves drug recognition experts.
Hi, Trooper Garcia, Colorado State Patrol. The reason I'm stopping you is for your speed. A little fast back there and also...
Since the 80s, the police have used the DRE protocol to spot impairment for drugs like marijuana. But some medical experts and legal advocates have questioned whether DRE is junk science and whether police are playing doctor.
Right now, it's junk science that we're stuck with.
A lot of those tests give the DRE police officer the appearance of being scientific. But when you look closely, it's just the appearance. There's no substance behind it.
DREs, or drug recognition experts, are officers that are trained to decide whether someone is driving impaired and what drugs they might have taken. DRE officers are in every state and they can testify in court.
The idea behind it obviously primarily is impaired driving to reduce fatalities across the United States on highways with impaired driving.
It purports to be a system that uses observation, some scientific and biological, and there's analysis that gives police what they believe is the knowledge necessary to not only detect if someone is impaired by drugs, but by which class of drugs.
The test has 12 steps, like checking eye movements, checking someone's ability to count seconds, and the firmness of their muscle tone. DREs measure pupil size and blood pressure. And the final step is a blood test.
Like I said, what I'm seeing right now, though, is I'm seeing everything is consistent with the central nervous system depressant.
So you have to trust the process of all the cues and clues. All of these things have been proven time and time again for years and years and years in both field studies as well as laboratory studies. And the science has proven that these things are correct. There's been a few times, I guess, in my career, I've heard of DREs just doing brief evaluations or a short observation and trying to rule a category in that, and you can't do that. That's not how the program's built.
We've seen a couple situations where police kind of have a preconception of what they think is causing a person to act whatever way they perceive that person is acting, and they turn out to be wrong.
Being accused, just accused, of using a controlled substance generates an arrest record, which is with you for the rest of your life.
Sometimes the officers get it wrong. That's what happened to Haley Butler Moore. She was arrested after speeding past a semi-truck on her way to a Halloween party in Denver, Colorado. She failed a roadside test, and the officer said that was because she asked for directions too often and her eyes were fluttering. She was taken into custody, where she agreed to a DRE test.
So my job is to determine what categories of drug is causing the impairment. What categories of drugs are causing the impairment?
What if I'm not on any drugs at all?
Then it should come out.
Haley assumed that the exam would clear her and she'd be able to leave, but the DRE decided she was impaired under the use of a central nervous system depressant. Once her blood test came back, her results showed no impairment.
Haley was so trusting of these officers to, despite them like repeatedly betraying her trust from beginning to end. I mean, they screwed her.
Some medical professionals have argued that the tests done by DRE officers don't reveal anything about what drugs are being used, that everyone reacts differently to drugs, and it would be impossible for them, even as medical professionals, to determine that question with these methods on their own.
I think one of the biggest keys to the DRE and the evaluation is there's a portion of it called the downside effect. So if they get arrested for DUI, go all the way through an evaluation, and it's ruled in there that they basically produced a CNS depressant type evaluation, send off the blood, and the blood comes back positive for a CNS stimulant. That doesn't mean the DRE was wrong.
Another measure of accuracy that the DREs use is a measure of accuracy that no health professional would ever use. The DRE is allowed to get 2 shots at getting it right.
Research studies have shown that DRE officers don't always agree with each other's findings.
I think the idea is that if you talk to the hardcore proponents of this system, that they believe that if you have people looking at the same criteria, same responses, but they're going to reach the same answers. And I think even through studies that have been presented, that's not the case.
Clinically, I can't control a depressant making my pupils dilate. I can't control methamphetamine, which is an upper, or cocaine. I can't control it raising my heart rate, which is going to raise my blood pressure. Like, you have to rely a lot on the clinical things and the science side of things because you can't control those things.
It looks like DRE is something that is going to be sticking around for quite some time, even despite challenges from courts and from defense attorneys who are trying to call it junk science. And that's really because a lot of law enforcement is at a loss as to how they can enforce and convict people, especially with the rise in legal marijuana use and other concerns surrounding prescription drugs.
When police officers arrest somebody and charge them with something as serious as DUI, they should have a level of confidence in that arrest. And trying to expand the net to bring in more people brings with it a lot of risk of ensnaring innocent people. If you're going to use it, you need to use it with some degree of humility.
When police get it wrong with DRE, the impact can be drastic on people's lives.